endwara eri chronic ninga etarakira n'endwara mbi muno.
Health experts, government authorities and stakeholders in Kigezi region are urging the public to adopt proactive health-seeking behaviors to manage non-communicable diseases NCDs at early stages, helping prevent severe complications and deaths. This call was made during a press conference today held at Chirijime Guest House in Chirijime Ward Southern Division of Kabale Municipality in anticipation of the upcoming National World Diabetes Day celebrations on November 14th, 2024 at Kabale Municipal Stadium. The campaign is led by Honorable Dr. Nicholas Thaddeus Kamara, Kabale Municipality Member of Parliament and Chairperson of the Parliamentary Forum on Non-Communicable Diseases. Speaking during the press conference, Dr. Kamara emphasized the financial and health burdens of diabetes, describing it as a chronic condition that requires consistent daily care. He stressed the importance of educating the public and lawmakers on NCDs, stating that as chairperson of the Parliamentary Forum on NCDs, he ensured that colleagues in Parliament are well informed so they can advocate for preventive measures and better healthcare policies.
This day is to raise awareness, number one. And I think my colleagues will talk about it, especially the health educator. The second reason we have this day, it is advocacy. To continue advocating, first of all to government, secondly to our funders, to increase more resources and improve the care of people living with non-communicable diseases. But especially for this day, we are talking about diabetes. The third reason is that these are chronic diseases, non-communicable diseases. As a parliamentary forum on non-communicable diseases, we advocate within Parliament. We are advocates within Parliament to make sure that the MPs, first of all of them are conversant with non-communicable diseases. Secondly, they can be giving information wherever they are because they are representatives of the people. Thirdly, that they can improve appropriation of funds towards non-communicable diseases.
He revealed that according to the Ministry of Health, 1 in 4 Ugandans has hypertension and NCDs are the leading cause of death among those over 40.
What we know is that 1 in 4 adults in Uganda have hypertension, have high blood pressure. And what we know is that for people, the causes of death, for people among 40 years, the topmost cause are non-communicable diseases, like 60%. It is the leading cause of death among the people who are above 40 years. And 1 in 4 people live with hypertension. That's how bad it is. Okay? For diabetes, who have been around 1%. 1% of the population has diabetes. You can calculate that.
Kabale District Health Educator Dr. Alfred Besigensi highlighted the tendency for residents to seek medical help only when diseases have progressed, often resulting in severe complications such as kidney failure, vision loss and more. He reported that 26,916 cases have been recorded in Kigezi health facilities, with 19 related deaths despite the availability of diabetes treatment services at Health Center 3s and 4s facilities nationwide.
Cumulative number of patients we have in the district was actually very high, 6,916. That's a single disease. That's a very, very big number. Remember, these are the ones who are coming in the facility, and they have been taking their medicines or they are just diagnosed. But we also lost 19 people. And these 19, these are people who died in hospitals. We don't know the friends who died in Ruvaya, who died in town because of those diseases. And they are the majority actually. So you can see this is a very big problem that we need to come together and address very fast. He has said we have addressed it.
Adding to the presser, Dr. Geoffrey Anguyu from Kigezi Healthcare Foundation Chihefo Clinic urged the public to prioritize routine health checkups and reduce consumption of high-fat foods and sugary beverages such as pork and sodas, which are known to exacerbate diabetes and other NCDs.
When you come for screening, when you come for those regular testing, when it becomes part of your routine, then you test. And we have seen the trend, you see, someone has been having sugar level like this, now it is changing like this, so now we advise them. Even when the slightest change, we advise on how to eat, what to eat, The biggest challenge is on diet.
This year's World Diabetes Day, celebrated under the World Health Organization theme, Diabetes and Well-Being for 2024-2026, and this year's Uganda theme, Empowering Individuals, Families and Communities for Better Diabetes Life in Uganda, will feature a walk through Kabale town and exercise sessions aimed at promoting physical activity.
The first thing is my colleague, Dr. Anguyu, with the chair for they are going to be testing for free from today. 11 is up to 17. Testing free and giving free health education for diabetes. They're going to be testing blood sugar. Then tomorrow we shall be having testing in Bugama by Global Livingstone Institute. And then on Wednesday we are still organizing, but we think we shall now deal with our patients who are known at the Kabale Hospital, Rugarama, and Rushoroza Hospital, because they need particular care, which the messages you give to patients are not the same messages you give to what? To people who are screening, or people who have just been newly diagnosed. So the patients will have their own day on Wednesday. But meanwhile, the chef for him will be checking. Then on Thursday, we shall have a walk in town, again for awareness and advocacy. Then we shall go to the stadium, we shall have exercises, physical activity. There will be people giving us physical activity and how you can exercise if you want, which is necessary. Then we shall go for the real meet, where we shall have many speeches of advocacy. We have many partners coming. One of them will be here on Wednesday. And then we shall have a football match and probably volleyball match in the evening. And we shall crown the
This story was compiled by King Solomon Twinamasko and Norbert Ndiamhachi for Kigezi Television.